for actually about 30 years. I've been doing this work with culinary nutrition, and it was never called Teaching Kitchens then. And I really thank Danny for starting us off and talking about how this is not new, right? This work is not new, but we've lost a lot in our culture about how to eat and what to eat. So I'm actually an accidental public health practitioner. I was a food and wine writer and a restaurant consultant thrust into a single motherhood thing that I wasn't planning. And my young children, 2 and 7 years old, showed me that we had a solution, cooking together in our kitchen. And it seemed so easy. And it changed a lot of things for me besides, believe me, they were eating a lot of new things. But what it really changed for me is I found a time to bond with them too. And I was so intrigued by that. And I looked at the mothers around me in my generation. They were looking to be in the boardroom. They didn't want any part of the kitchen. So I decided we had to change that. And I went out into schools and into community organizations, even cooking schools, teaching something called family cooking in the 90s. And as time went on, I wrote a book, Cooking Time is Family Time. And that showed me that the classes that I was bringing to all these places, and I was doing it with dietitians and, a group of people, that those classes were actually beyond, didn't matter the socioeconomic level that we were teaching, where we were and what their level was. People were responding the same way. So that told me that we were onto something in an approach. So from there, we started to, of course, see how we can, if we're going to grow something, you've got to do the research. And that brought me to working with different universities. And that brought me here to APHA. And suddenly I found my tribe. It was like people that think at a population level, because everyone that I was talking to was thinking, oh, wouldn't it be nice if there were more classes like this in New York? And I'm like, no, we need much more than that. So once I found my tribe here at APHA and started doing more and more research and developing more across the age span, right? Interventions that we could scale around the country through many different creative ways. As that was happening, then in the last 10 years, the food as a medicine with the food provision and the teaching kitchens that doctors and clinicians have been interested in started bubbling up. And I just thought, all right, there's something here, and I need to make sure that we're also offering programming around chronic disease. And as we were doing that, I was asked to be part of the Teaching Kitchen Collaborative. And that is something that was founded through Harvard School of Public Health, and obviously people like me. So then I found a new tribe. And when I found that tribe, I discovered that people were all of us in this tribe were looking at food as medicine and saying, there's something else that is needed here in the way this is being approached. So we developed a framework, a whole group of people. We had people from Dartmouth, from Harvard, so many people. Even MedStar, the health system here in Washington, was part of this framework. And what this framework is saying is that this is our vision, right? That when patients are diagnosed, there should be a trifecta of nutritional offerings and available to people. Absolutely screen them for the food insecurity, provide food to the people who need it, let them be able to be referred to a dietitian, and then let them learn to apply those dietary recommendations through skills in food and cooking. And if you do that, then you can see you're going to get some lifestyle behavior changes. And then we even outline our best, all these people, our best recommendations for data to collect, so that if everyone would, more people would be inspired and do this, you will end up with information for the payers and for your hospital administrators to be able to see the value of this in a comprehensive way. So that's what I believe is missing. And I also believe that the people that are so, looking at the food provision and the food insecurity piece are not wrong, that is super necessary. But what I have learned from all these years is that people need more than to be provided the food. And you know what? They don't just need a recipe and even for us to teach them nice skills. In other words, just the education. You know what they actually need? They need motivation. And what I've learned is that the motivation comes from an experience that is repeated and happens over several times. that it's with your peers and people like you are going through the same experience together. So that is, what I am hoping and calling for with all these Teaching Kitchen colleagues, for us to align. And then the most important thing when we're here at APHA is that's where public health comes in. The public health infrastructure that has been built up around nutrition education, around SNAP-Ed, FNAP. I could go with a crazy salad of government programs, but there's just so much that exists out there, and it needs to be aligned. We need to find a way to align it with all the food provision work so that there can be comprehensive interventions.
Thanks so much. I have one more question for you. Because the food medicine landscape has changed so much over the last 3 decades when you began working in it, I'm wondering if you can talk about the changes in strategy, the changes in funding that you have found.
We need a really long time for me to talk to you about all the way we deal with funding. I will tell you that the main reason that we've been able to, we're a small nonprofit, the main reason we've been able to continue to persevere in this work, besides being very nimble, is because we ask the big questions and we like data. If I don't have a way to collect data all the time, I'm not a very happy person to work with. So because we approach it that way, I can give you one really good example of over 10 years ago. I'm sure a lot of people in here remember when the WIC package was changed in 2007, and we're all of a sudden now we could offer fruit and vegetables. We answered an RFP for an organization, a philanthropic organization, that wanted to have a WIC intervention for parents and young children for fruits and vegetables. So we came up with something called our early childhood program called Willow, and we developed that, we tested it, then we rolled it out to 13 states and multiple WIC centers in 13 states. We even did an evaluation like that on very little money. But then in 2017, I think people know what was going on then, there was the public charge rule, and they lost all their staff and they couldn't continue that program. So do you think I was going to abandon this program? No. So what we did was we retooled it for preschool. And then we went deep into the program to make sure that it was not just a healthy eating program, because we were not going to have any success in preschools with that. And we made sure that it had a lot of early learning embedded in there so that teachers would love it. It would help them teach all the things they need to teach, and they'd ask for it. So last year, after all this work, we were awarded $1 million from the Robin Hood Foundation to expand this in New York and beyond. And now, because we did such a good job with that in New York City public schools, they are going to fundraise with us to early childhood philanthropy to start getting 100 schools on board every year. But that is, that's a journey. That's like 15 years.
Yeah, that's really exciting. Congratulations on the money. Give her a round of applause.